guys, welcome back to my YouTube channel. Today our topic of discussion is Norma occipitalis, and then we will talk about Norma frontalis, and later on we will talk about Norma lateralis, and then we will talk about Norma basalis. So video will be very informative and useful for all of you, so don't miss any part of the video. Let's start the video and discuss the most important information about the Norma frontalis. First of all, the Norma frontalis is roughly oval in the outline, being wider above than lower and below. Bones in which frontal bone, and then left maxilla, right and left nasal bone, zygomatic bone, mandible, frontal region, orbital opening, anterior piriform shaped bony aperture of the nose, lower part of the face. Then we can see here the details of the frontal region, orbital openings, as well as anterior bony aperture of the nose. Anterior bony aperture of the pear shape being wide below and narrow above. Above by the lower border of the nasal bones, below by the nasal notch of the bone or body of the maxilla on the east side. Features are the given below. Articulations of the nasal bone are anteriorly with the opposite bone at the intercostal suture, posteriorly with the frontal process of the maxilla, superiorly with the frontal bone at frontal nasal suture, inferiorly with the upper nasal cartilage. Clinical anatomy. The nasal bone is one of the most commonly fractured bone of the face. Mandible and parietal eminence are the next bones to be fractured. It is very important point to be prepared for the MCQs and normal IQ level. Most fracture bone of the face is nasal bone, and then we will talk about the mandible and parietal eminence for to be fractured after the nasal bone. Let's move toward the next, which is Norma lateralis. Norma lateralis, in which bones are frontal, parietal, occipital and temporal, sphenoid, zygomatic, mandible, maxilla as well as nasal. If we talk about its attachments, the middle part of the superciliary each gives a region to the corrugator superficiae muscle. Parochial muscle arise from the nasal bone. Orbital part of orbicularis oculi arise from the frontal process of maxilla. Middle palpebral ligament is attached to the frontal maxillary region of the orbicularis oculi. Levator labii superialis elaquae nasii arrive from the frontal process of the maxilla. Levator labii superialis arise from the maxilla between the infraorbital margin and infraorbital foramen. Then we will talk about next topic, in which we will talk about Norma basalis. So let's move toward the Norma basalis. For the convenience of the study, the Norma basalis is divided arbitrarily in the anterior, middle and posterior parts. The anterior part is formed by the hard palate and the alveolar arches. The middle and the posterior part are separated by imaginary transverse line passing through the anterior margin of the foramen magnum. Anterior part of the Norma basalis, alveolar arch, hard palate. So first of all, talk about alveolar arch. Alveolar arch prepare the sockets for the root of the upper teeth. Hard palate formation, anterior two-thirds by the palatine process of maxilla. Suture, palate is the crossed by cruciform suture. Dome, it is arched in all directions. Show pits for the palatine glands. Incisive foramen is a deep fossa situated anteriorly in the median plane. Two incision canal, right and the left, passes the wall of the incisive foramen, usually one on each side, but occasionally in the median plane, the left being anterior and the right posterior. Greater palatine foramen on one on each side is situated just behind the lateral part of platinomaxillary suture. A groove leads from the foramen toward the incisive fossa. The lesser palatine foramen, 2 or 3 in the number on the each side, is lie behind the greater palatine foramen and perforable and pyramidal process of the palatine bone. Now we will talk about the medial part of the Norma basalis. Medial part extends from the posterior border of the hard palate of the tributary transverse line passing through the anterior margin of the foramen marginum. Median area shows the posterior border of the vomer, broad bar of the bone. as well as mover separate the two posterior nasal apparatus. Palatino-naviginal canal is also available, and vomer vaginal canal is also present here. So this is the diagram of this. If you have any query about this, please ask us in the comment section to clear your views and conceptions. Thank you so much for supporting and liking the videos.